In today's video, we're going over upper body plyometric progressions for return to sport in your athletes. Upper body plyometrics can be very important for your patients who are returning to some sort of sport that requires plyometrics. Think about a baseball player throwing baseballs, obviously javelin, footballs can be another one, tennis serving, volleyball. Think about Olympic weightlifters throwing that weight overhead, gymnasts. They need to be able to absorb impact and then create that force very quickly, right? So doing upper body plyometrics is really important to bridge from basic strengthening over to higher level of play. We use those to have better outcomes for return to sport for our patients. In today's video, I'm going to talk about how I like to do it. So first, a few goals that you should have for your patients before they start plyometrics. These are going to be especially important in patients that have a surgery and they're coming back from that and trying to get back to a higher level of sport. So a big one is going to be full pain-free range of motion. Also going to be symmetrical strength side to side. You might also want to think about having a baseline level of strength. If you want to see some specifics for range of motion as well as strength for baseball players, make sure you check out my video on slap tear treatment. I'll leave a link in the show notes in the description so you can see what I'm talking about. And lastly, I like to have several weeks, even several months worth of basic strength training and basic movement patterns like presses and rows, all of the different types of movements you typically see in the gym. A lot of good benefit to that, and make sure we have a little bit of a baseline before we start throwing things around. Next, a few basics about plyometrics, and honestly, we're not doing true plyometrics once we start to introduce these. We're more kind of introducing power, introducing impact, right? The idea is you're starting to build a little bit of capacity. We're not really trying to accelerate a medicine ball as fast as possible the first time we do that with an athlete recovering from, let's say, a rotator cuff repair, right? So largely we start with lower RPE, and the intent is basically a light throw. Over the course of time, obviously we want to throw harder and harder and harder. So we may start with higher reps, just basic, easy throws. And over the course of time, we increase the intent, throw faster, 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 reduce the reps, so we're getting more of a power adaptation.
To go along with today's video, I have a free evidence-based cheat sheet on slap tears. I'll get you up to date on all the literature on slap tears in under 10 minutes. We go over anatomy, prevalence, and risk factors for getting a slap tear. We go over the mechanisms of injury as well as a clinical presentation. We cover differential diagnosis as well as diagnosis. What are the best treatments for slap tears? Is surgery effective for a slap tear? And is physical therapy better than surgery for slap tears? Lastly, what are the return to sport rates for slap tears, both conservatively, so with physical therapy, versus getting a surgery, so either getting a biceps tenodesis or a slap repair? It's a 5-page PDF. It's 100% free. I'll leave a link in the description. Go ahead and click on that and download it and get back to this video.
Generally, we're also going to start with two-handed plyos and progress our way to one-handed plyos, basically because this is easier, this is a little bit harder, right? Think about your post-op ACL reconstruction. Usually start squatting with them first. If they're tolerating that really well, we move to single-legged squats, just because we want to introduce the force at a low level and then work our way up. We do the same thing with plyometrics. Next key is we start by limiting the stretch shortening cycle. And I stole this directly from Dave Tilley, who's sitting right over there from shiftmovementscience.com. Definitely recommend checking him out. But if you think about it, we're throwing a ball against the wall and we're catching, and we have to rebound and throw multiple times. You have to be able to catch that ball, decelerate it, and then rapidly accelerate that, which is pretty challenging for the shoulder. If we just throw the ball against the wall and let it fall down and don't catch it, that's going to be a little bit easier. So generally we start by throwing without a catch, and eventually we progress towards more rebounding. And lastly, we go with basic simple exercises, and then we eventually want to progress towards specific exercises. So I may start with something like a chest pass against the wall, and if I want to get back to baseball and if I'm a pitcher, I want to start working in this 90-90 position and start doing my plyos up here eventually. We start easy, and then we go specific over the course of time. So the first 3 throws I like to start with are all throws without a rebound. So essentially Jackson here has a medicine ball. Start lighter. You can always go heavier over the course of time. He's going to do a basic chest pass into the wall. And as you can see, he's not catching and rebounding. He's just letting it hit the floor, picking it right back up again. He's also not trying to throw as hard as he possibly can. Producing a little bit of power, not much. We're trying to build a little bit of capacity, right? Second one we can do is a soccer throw. So essentially Jackson can take this overhead and toss it right into the wall. Very good. And again, he's not catching it. He's letting it fall to the ground, picking it right back up again. And the last one is going to be a slam. Let's have you take a step forward here, Jackson. From here, start up nice and tall. Onto your toes. Land. Yep, very good. Watch for your face. And when you land, I like to tell people, think about you're landing from a jump, right? And you're about to jump again. So start up nice and tall, ball in the air. Yep. slam it down, land in that jump position. Very good. And that's it for these guys. So one of my favorite introductions to single arm plyometrics is simply using a Kaiser machine. You can also use a band, works really well. If you have an anchor system, that also works really well. Cable crossover, cable stack typically doesn't work very well because if you move quickly, the weights will move up and they'll slap back down again, which is not good for your equipment or for the patient, all right? So essentially we can set up either square or split stance, just like Jackson is right here. And from here, we're trying to punch, rotate, and then try to produce force quickly, reaching out in front of you, right? And this is actually a really nice introduction because where bodies are used to so far doing a bunch of basic pressing exercises, all we're doing is adding a little bit more speed here. So nice transition from strength training over to power. So we can also do the same exact thing for a row. We have our athlete Jackson here. He's in a split stance. You can do a split stance or a square stance. Either is fine. And from here, he's going to aggressively rotate and pull. Very good. On the return, nice and controlled, and then pull nice and fast. So again, we're producing a little bit of power. Our athletes have already been exposed to a bunch of different row variations. This is the same thing, only a little bit more quickly, right? So once you introduce your chest passes and your soccer throws where the ball just drops down the floor, athletes tolerating these really well. They're not getting extra swollen, more painful, more irritated. We can start to incorporate the rebound. So essentially you get a little closer to the wall, be careful. First time an athlete does this, sometimes they slam themselves in the chest with the ball. Just make sure they're ready for this. And the idea is that we're gonna try to rebound off the wall and catch it and throw it back quickly. You mind doing a few reps over here, Jackson? Excellent. And generally speaking, just like before, we start with kind of a lower RPE, lower intent to power, and as we progress over the course of time, you get a little bit more athletic. We try to push a little faster, rebound a little faster, okay? Second thing we can do is a soccer throw. This time we just get a little closer to the wall. Ball's gonna go overhead. He's just gonna slam this against the wall, catch it, yep, and dribble overhead. Just like before, start with a lower intent, over the course of time, a little bit more power. So one of the things I highly recommend is that when your patient is doing their plyometrics, you go ahead and just steal their phone. Go to the Fitness Pain-Free channel and then just go through all the videos. Start liking all of them, comment, definitely subscribe, over and over again. Make sure they don't see you doing this because otherwise you're gonna look like a weirdo. So we've gotten through the double arm throws without the rebound, with the rebound. We did a few cable punch presses, shoulders still feeling pretty good. We can actually move to a shot put toss here. We start without the rebound first, so Jackson's gonna take the ball. He's a baseball player, so he looks pretty good when he rotates. Essentially, we're trying to drive off the floor, pushing off that backside leg, rotate the hips, punch the arm, finish at the wall. One cue I like to do, give my athletes, is basically to turn your hips, try to have them face the wall once you finish the rep. Let's do a few more right here, Jackson. And yeah, Jackson looks really good. So once your athletes are tolerating this exercise really well, we just work way over to a rebound. Let's go ahead and grab that bouncy ball right here. Same idea, sometimes you have to go to a different place, a little bit further, a little bit closer to the wall to make sure you rebound it appropriately. Let's see a few reps here. And bounce, catch, and then right back to it. A little faster if you're able to. Good catch, and then rebound. Nice, good job. As you can see, it's gonna be a little more challenging to catch that and throw it again. So after all these stages, we're probably ready to start moving towards more specific exercises. So let's say Jackson's trying to get back to pitching. He's a baseball pitcher. We're gonna get more into positions that are gonna be utilized throwing a baseball, obviously, right? So the first and most common is gonna be 90-90 dribbles against the wall. So he's at 90 degrees at the elbow, at the shoulder, just dribbling, right? We can also do some T dribbles, so same idea. Jackson has his arm out a little bit wider, just like so. You can also do some Y dribbles. So we're getting a little higher, working on producing force up there. All right, so as a baseball player, obviously we have to accelerate a ball. We also have to decelerate our arm after release the ball, right? And we think that the reason why folks get injured is because of this position here, so much force in the shoulder, or having to decelerate our arm. So we can actually work towards getting better at decelerating the arm by picking the same exact exercises, but now we're in quadruped, we're working on decelerating the ball. So essentially Jackson's gonna be on his hands and knees, he's at 90 degrees, dropping, catching, dropping, catching. You can see how we're working on very quickly decelerating that ball. We can do the same exact thing in a T position. Yep, dropping, catching, dropping, catching. We can also go into a Y position, right? Which is also pretty specific to the follow through of throwing, right? All right, so once you get through a couple weeks of double arm throws followed by single arm throws, working your way towards rebounding, your athlete's probably ready to start throwing, right? So it's important at this stage you incorporate an interval throwing program. If you want a really good one, I'll give you Mike Reynolds' latest one that he just published in IJSPT. I'll leave a link in the show notes in the description. Definitely check that out. But also keep in mind that we're going to be working with athletes that need to produce power that aren't throwers always, right? So if I'm working with someone who's an Olympic weightlifter, maybe I'm thinking about incorporating higher force exercises like overhead press with dumbbells, using a little bit of speed. I maybe use a landmine press where I can use my lower body and drive a bit more. Maybe I'm doing more push press. Over the course of time, I work my way into jerks, starting with lighter loads and then progressing towards heavier loads over the course of time. So rehab essentially just needs to be very specific to the needs of the patient. Obviously, when you do a push jerk with a maximal load, it's going to be fast, right? But it's nowhere near as fast as throwing a baseball. When you have a heavy load, in the case of Olympic weightlifter, and a baseball player, it's a very light load. So just think about how you program your plyometrics and make sure it's specific to the needs of that athlete. All right, you have a good idea of how to progress your plyometrics with your patients. When you start doing plyometrics though, it's not like you get rid of all of your regular exercises. You still need to progress them. So I have a video for you. I'm gonna leave a link in the corner. It goes over my favorite exercises and treatments for slap tears, given that a lot of folks have slap tears or trying to get back to higher level baseball, pitching, overhead athletics. So go ahead and click on that link, and I'll see you in that video.